Now we're going to work on our healthy versus unhealthy coping strategies. The form is in your packet. So let's look at our first box. Describe a problem you are currently dealing with. So we're going to use Tamika as an example. Tamika just broke up with her boyfriend, so she's feeling a little depressed. Now let's move to the second box. Tamika's unhealthy coping strategies. Drinking wine, number one, and number two, smoking cigarettes. The consequences of the unhealthy coping strategy of drinking wine is that she will break her sobriety because she's in recovery and she shouldn't be drinking anything or doing any other type of drugs. The second unhealthy coping strategy is smoking cigarettes. Now, people do smoke while they're in recovery. However, they still must understand the consequences of this unhealthy coping strategy. It will eventually lead to some type of asthma, bronchitis, or it could also lead to lung cancer or any other type of cancer like oral cancer, because you're actually inhaling the smoke and it's going down your esophagus into your lungs. So any other type of cancer that is related to smoking could be a negative consequence of this unhealthy coping choice. Now let's move to the healthy coping strategies that Tamika could use. For example, Tamika could go exercise, talk to a friend, or go to a meeting. And I'm thinking a AA meeting because Tamika has an issue with drinking alcoholic beverages. So the healthy coping strategy that she would use is number one, exercise. So the expected outcome of healthy coping strategy of exercising is that she will have a toned body. The barriers to using this coping strategy is that she may not be able to get to the gym. So in a situation like that, she should exercise at home. Number two is the healthy coping strategy of talking to a friend. And so the outcome of talking to a friend about the breakup between her and the boyfriend will help her to feel better and less depressed. Now, the barrier to using this particular type of coping strategy is the friend may not be available when Tamika needs her to be available. And so, in that situation, Tamika should have a list of people that she can call. If one person isn't available, she can talk to the next person. And the third coping strategy is going to a AA meeting. And the expected outcome is that she will meet up with people that she know at the meeting or her sponsor. And at this particular time, she could talk about her problems to her sponsor. And then the sponsor will, encourage her and motivate her to stay sober. And of course, the sponsor will, talk to her about other things that Tamika may want to talk about. Now, the barrier to using this particular coping strategy is not many, unless she's a newcomer to the AA meeting and she may not know anybody at the meeting. At that point in time, Tamika can reach out to someone in the meeting and let them know she's a newcomer and that she needs some assistance and some help because she's really trying to stay sober. Okay, so that ends our healthy versus unhealthy coping strategy worksheet. What you are to do at this point in time is to think very seriously about your coping strategies and complete the boxes that's on the page. Number 1, describe a problem you are dealing with. Number 2, write down your unhealthy coping strategies and the consequences of using these unhealthy coping strategies. And number 3, the healthy coping strategies to use. What would you do that is more healthier than what you've done in the past? And what you've done in the past is use your drug of choice. Now, I want you to understand that what we're trying to do here is we're trying to replace your unhealthy coping strategies with more healthier coping strategies. So now, take the opportunity to complete the worksheet. Until we talk again, be blessed and have a wonderful evening.